Welcome to the Roundtable Consult. I'm your host, Dr. Mark Williams, and I'm joined by my wonderful co-host, attorney Tanya Madison. Tanya, good morning to you.
Good morning. Look at it. You're so excited when I actually showed my visual smiling face. I just couldn't deny you of that wonderful pleasure.
Okay, let's go with that. It's always...
Well, from the judiciary who does not compromise,
Oh.
I did want to at least
Really?
talk about two Supreme Court decisions. Hey, we talked about Clarence Thomas, and now we've got, I think Justice Alito also admitted that he's, done some things that could be compromised into ethics, but he doesn't go into detail about that. And Justice Roberts refuses to have the Senate tell them what is ethical or what isn't. So yes, the Supreme Court is saying, hey, we'll handle this. We're not compromising to meet what you guys' concerns are as it relates to ethics. But they did have at least two decisions that came out this week. Not surprisingly, both of them are more pro-conservative than not. We've got one is dealing with labor unions, which of course is my wheelhouse. And in that decision, essentially the facts were, and as you guys often know, striking is legal. If you have one or two, not even one, two or more people that have desired within an employment setting to say, hey, we don't like certain conditions, we want to either force a union or we want to strike to compromise, as you like to use, or to settle our differences with the company, then legally under the National Labor Relations Act, ideally you're able to do that. Well, this opinion, this was Glacier Northwest versus the International Brotherhood of Teamsters. And again, the International Brotherhood is a union. Under those facts, they did not agree on certain working conditions. And instead of continuing to negotiate, what the employees did, or at least a couple of employees did, it is to say, hey, we know we're supposed to mix this thing. We're going to stop doing that. And we're just going to go on strike. And what the employer argued was, will you intentionally compromise our product and therefore our bottom line in order to insert or to get a deal rolling? And of course, the union is saying, hey, that's all right. Under the law, we can strike because we have collectively come to an agreement that we do not like certain working conditions. And so the lower courts were saying, yep, the federal law preempted that. Sorry, employer, but yes, they have the right under the NLRA to do so, to strike, even if that meant compromising some of your product. Supreme Court said, no way. You intentionally sabotage this employer's product, you will pay for it. And no, the federal law does not preempt the damage that you have done to this employer by intentionally going on strike, which a little surprising. But what was also interesting was this was the first time that Justice Ketanji Brown Jackson put in her 2 cents and actually wrote a separate dissenting opinion and essentially discuss how confusing this decision is, because obviously going on strike is a bargaining chip. So if you go on strike, yes, that does mean that the employer's products or services are going to be compromised, as that's how you try to push on a deal. But if now you're saying, hey, you intentionally did this to push something and sabotage me, then it's going to confuse courts going forward as to what constitutes a protection under the Labor Relations Act and what constitutes intentional sabotage under any other law that can subsequently then overturn your protections under the Labor Relations Act. So as someone who represents employers and often sees the employer side, I was a little bit surprised by this decision in that realm.
And it doesn't surprise me, because I think that there's an ultimate goal of silencing the popular voice. The people, basically the proletariat, and that's what I would say. It's all about silencing the proletariat. We see over the past several weeks, frankly, about how the consumer himself is now having a huge impact on corporations and corporations' behavior, on corporate behavior, whether it's in your favor or whether it's in your disfavor. Chick-fil-A, Target, and Kohl's, a number of corporations who've just recently come under fire for their support of Pride Month. Bud Light, for example, and Anheuser-Busch. These companies have lost revenue. You could argue under that same the same clause or the same argument that the Supreme Court makes, is that you intentionally inflicted harm on a corporation. Well, that's the way that we get corporations to respond to the needs of the people, whether those people are consumers or whether those people are employees. The way that you get their attention is affecting their bottom line. And when their bottom line gets affected, then they're motivated to say, okay, I'm going to make or implement changes that are requested by the employee, reasonably requested by the employees and or the consumers. And that is a bit disappointing of a decision that's come down, but that's what we get. Elections have consequences, they say.
It's just the tip of the iceberg. As more decisions are going to come down, we'll probably just warn it almost weekly. And then I'll go through one more, and this is going to hopefully tie into our discussion with our guest today. This was a decision related to the Environmental Protection Agency, and they've been trying to regulate carbon emissions. And as you guys, again, you probably know, but I'm sorry, just humor me for a second. But when we're talking about the EPA, we're talking about a federal agency that goes about trying to enforce various laws that not only Congress has authorized to do some, but also that they have established professionals and experts to better ensure that, hey, whatever the employer is doing is not going to compromise what is a general public good. And in this case, we're talking about the environment. And so they've been trying to regulate carbon emissions to some degree, combat or address climate change. Supreme Court said, no, that is too much of a power that is not delegated to you. If Congress does not specifically say, hey, you go regulate climate change, or you go put in certain tools and measures or regulate laws or whatever to ensure that employers are not putting forth any type of efforts that could hurt or whatever. If Congress did not assign that to you, that is not your job. You are then only assigned to ensure whatever Congress has authorized as law that you then go forth and enforce. To me, that's kind of a mix, because I do understand the importance of the separation of powers, and Congress is tasked. If they see, hey, there's a problem, you should put the law in place and then ensure that you have your agencies in place to enforce it. But at the same time, the agencies are the professionals, they're the experts, and you've tasked this agency to do those, to essentially ensure the goal, and in this case, the goal of the environment and making sure we're not tearing it up, to ensure that that does not get compromised. And yet here the Supreme Court saying, no, that is not what you're supposed to do. And as such, an employer is not bound to your regulations and restrictions. And so I say it's kind of ties in, because oftentimes I'd imagine in the medical field, you guys can be restricted a little bit by the FDA or by, just agencies that say, hey, before you go put this drug off, or before you go put certain diagnosis off, let's make sure that the agency is approving the drug. And so in that realm, you kind of, to some degree, may rely on the agency to give you the heads up, but now they're saying, hey, the agency doesn't have that power. Go, doctor, freely do whatever you do. And until Congress says, no, you can't, we're going to put this law in place to ensure that certain drugs or certain opinions and diagnoses are not put out there, you as the employer, even if it's a medical practice, has that autonomy to do so. And so, again, it's another interesting decision. And again, as someone who represents employers, I understand that these are both wins for the employer, but at the same time, it could also potentially be some blows for the environment or for public good.
It sounds like it's a precursor for the FDA, particularly as it relates to the abortion bill, because there had been this whole conversation about whether or not Congress or the courts can ban something that was approved by the FDA, a medication that was already approved by the FDA. And so now we've got the judiciary superseding its expertise and its right and imposing its will on medical agencies and the FDA. So I don't know. we'll see what happens with that.
I don't know. And I was a little, to some degree, surprised. At least that last decision was more 6-3. So it was slightly divided, although not so much. But Justice Roberts, and I give him a lot of credit, but now I'm probably going to start taking away. He tends to be this, hey, Congress has authorized it until they say no. Then these agencies are authorized to enforce how Congress has deemed fit, and Congress has the power to overturn if something goes wrong, which we've seen happen even with gay marriage. I mean, states were doing.
Which would be the federalist position, though, right? I mean, that would be the federalist position. Why would you have an elected Congress? Why would a judiciary supersede that? And so that elected Congress is supposed to represent the federation, those individual states. And I don't know, but the judiciary is seems to be flexing its muscles right now just because it can.
Yeah, because it can, and it is under the microscope. But I also still imagine that they wish that they weren't under the microscope. But some of these opinions that are going forth, you can't help but to make decisions on, because I do think they try to avoid a lot of opinions that they know will be controversial. But I mean, opinions like this, to some degree, we're all looking for you to make an answer, and they do so. But I wish they would recognize, hey, we're just here to enforce it. And so far, Congress hasn't made a law saying otherwise. And so, but they've been very strategic, or at least consistent, in allowing these agencies to go forth as they see fit. Who am I to then check that? But, oh well.
Well, on to a more light subject. I'm not just light skinned, but we have today we're welcome with we're excited. Let's go with your colorism again, and hopefully we'll talk about colorism and where that all came from. But today we are excited to host Dr. Nashay Clementson. She was born in Jamaica and graduated summa cum laude with a BSN from Bethune-Cookman University, go HBCU. She obtained her medical doctorate from she obtained her medical doctorate from and completed her internal medicine internship at the University of Miami Miller School of Medicine. Her dermatology residency and fellowship in ethnic skin were completed at the Johns Hopkins University in Baltimore, Maryland, where she also serves as an assistant professor of dermatology. But prior to moving to Nashville, Tennessee, where we get to enjoy her, she served as she served as a staff dermatologist at West Palm Beach, the VA Medical Center, and as an adjunct clinical instructor with Broward Health Dermatology Residency Program. She's currently the founder and chief medical officer of a new practice in Cool Springs, Tennessee. Interesting.
I assure you, we do typically read before the program.
No,
Dr. Williams is getting more fascinated by your bio as he continues to read for the first time.
I just got a notification that my meeting will end in 10 minutes. So I think I may have logged into Zoom on the wrong account. So I apologize. If we disconnect, we're going to have to reconnect. If it kicks us out, I don't know. This is apparently my volunteer account, my free account, not the paid one. So I don't know what's going to happen in 10 minutes. If we get disconnected, then you know why. It tune back into us. We'll come back on live on a different account. But anyway, she's the founder and chief medical officer of 360 Dermatology, located in Cool Springs, Tennessee. She's a member of multiple national organizations, including the American Academy of Dermatology, National Medical Association, which is the Black Doctors Association, Skin of Color Society, Women's Dermatologic Society, and Tennessee Medical Association. Those things cost a lot of money to be involved in all of those. So
why you just put her on blast like that?
I'm telling you, you don't just sign up for these things. You have to be involved in them.
Yes.
You have to be committed to them, and they have to derive some value for you back as well. But she volunteered. This
He's trying to explain why he's not in it, but go ahead.
Because I don't have no money. Let me introduce our guest, will you? Jeez, just for a moment. But anyhow, I love that she volunteers her time with various community groups. She mentors the youth and aspiring physicians through the Student National Medical Association and the Nth Dimension. She's a board certified in dermatology. She's passionate about providing care to all patients, including people with skin of color and hair loss, and improving access to dermatologic care to marginalized populations. And so this is my gift to you, Sonia, Dr. Nashay Clementson.
Well, thank you, because I have been wanting a dermatologist on the show, and I've been encouraging Mark to get some new friends. So thank you so much for joining.
Thank you, Mark.
Well, first of all, I do want to make sure it's clear we all understand, specifically, because at least from a lawyer, oftentimes people will ask me, oh, help with family law issues. I'm like, that's not what I do. And so then from your perspective, when people do reach out to you, what part of the body do you want them to focus on, or them to understand that you have an expertise in?
So, yes, I don't want to be the doctor for everything, but I do specialize in anything that relates to the skin, the hair, and nails. So that's what dermatology is. It's the field that covers all conditions, which is probably over 3,000 of those related to skin, hair, and nails.
And it doesn't matter which part of the body, because the whole body is covered by skin. And
right.
You don't specialize in certain body segments, like,
No.
The throat, right?
so literally from the scalp to the sole of the feet. That's what I cover.
If it's covered by skin, you can come to see her. You can come in. Exactly. Anyway, I feel Jesse Jackson's coming in. So what interests you in dermatology? How did you get interested at all in dermatology? Were there any particular motivations, mentors, or experiences that you could share?
Yeah, sure. So, I would say, and I tell a lot of people this story because, it's not the typical, come to dermatology experience. For me, I think that throughout medical school, I never really considered dermatology as a specialty. I wanted to, be more involved in the guts and glory, considered trauma surgery actually very seriously. And it wasn't until my internship at the West Palm Beach VA that I was doing this, elective rotation in dermatology. And the my attending said to me one day, he's just like, you have an eye, like a really special eye for the skin. And I thought he was just, saying nice things as, attendings can. But it got me thinking about, skin on a different level. And then kind of along the way, there are patients who would, ask me about their skin because there are patients of color. And I figured they assumed, that because I was, physician of color, I knew everything there was about the skin. And I realized that there was that knowledge gap. So an opportunity kind of presented itself like immediately after that to do a research fellowship in ethnic skin at Johns Hopkins. And, as one might say, the stars may have aligned or it was providence, but I applied for that fellowship. I was accepted. And once I started to do it, it all made sense. Like, my personal experiences, as a child, growing up with, eczema and skin sensitivities, working as a hairstylist in college and, doing hair, like it literally just like came together. And I realized that this was a thing that, was kind of just oozing out of my pores all along. I just never realized it. So
no pun intended.
Yeah, exactly.
So there is a difference between like white, I shouldn't say white, but skin of color and white skin. And is that more so just the pigmentation, or is it even deeper beyond that?
So it's a combination. So I think that, skin that has more melanin, there are nuances to, how the skin will respond to, certain illnesses, diseases will present differently. For example, in a lighter complected patient, if the skin is, if there's inflammation, you'll see red. right? And it's like really easy to see. In a person of color with, darker, skin or more pigments, that red won't look like red. It may look more brown, it may look purple, it may look gray. And if you're not trained to pick up on these subtleties, you'll miss a lot. No, another thing that I see in patients of color too is that because the medical community isn't as well versed in the conditions that we might be more predisposed to developing, patients will go for a long time before the accurate diagnosis is found. And what that leads to, can lead to one, delayed diagnosis, worse, morbidity or outcomes. So they suffer for longer. The sequelae of their condition might be worse. And for example, things like skin cancer in patients of color will go undetected for a long time. And so when patients are finally, presenting or they're finally diagnosed, those cancers are well advanced and leads to, greater mortality rates in those patients.
Now, some of those delays in diagnosis, I guess some of it you could say is multifactorial. Some of it is because of access to care. Some of it is because of our lack of understanding of how they present in Black skin. Some of it is, maybe some of it is cultural. How do we distinguish between each of those and without how extending the extra vigilance that a physician of color might extend versus one who's less attuned to some of our concerns?
Well, for one, I think that for, everyone in the medical community who, has to interact with, patients of color, I think one of the things that, I would encourage them to first of all consider is, the patient as an individual, right? Because we're all the sum total of our experiences. So, I've found that just, or hidden biases, and those we are aware of, can, unfortunately put certain patients at a disadvantage. So for example, a patient may come in and, they've missed a couple of appointments, right? And when they finally show up, you might be upset that, they wasted your time, 2 weeks ago, a month ago, but you didn't factor in that maybe that patient had to take, 3 different buses to get to their appointment, right? And then when they come in, you might not be as attuned to what the patient is saying, what their complaints are. You might easily dismiss them. So one of the things that I do encourage is, to stop. You stop yourself in your own tracks and try to be present in the moment. Now, if you get to a point where you recognize that you don't have the skill set necessary to address the patient's concern, then referring the patient out to someone who might have the skill set.
Okay, we're back live on Facebook Live. My apologies for the technical errors, but before we were disconnected, Dr. Clementson was telling us about how difficult, how important it is for physicians when they realize that they may have patients that are outside conditions that are outside the realm of their expertise, that they refer them to an appropriate person, probably someone like yourself who's had a fellowship in ethnic skin. I didn't realize such a fellowship existed. How long have these things been in existence for a while?
So they're fairly new. In the past decade, I was the first fellow at Johns Hopkins. So, and their Ethnic Skin Institute or program is also one of the first in the country. So it's fairly new, but I think, yeah, I think that
interesting because for the most part, I feel like they used us as guinea pigs for so long historically to try to understand the medical field, but yet have no knowledge or sense of how to deal with our skin and our hair, which is, interesting enough for me. And when you said that, I remember when I was younger and I had started developing bald spots, it was initially diagnosed as wingworm, but then when that didn't work, it was, oh, okay, well, we'll now need to send you to a specialist because we don't know what's going on. But from your perspective, I guess, one, why is it that we as people of color, and it's particularly more African Americans, because I feel like even certain people who are darker skinned still have certain hair types that kind of aligned with someone about more of the white persuasion. But why is it that not only do they not know, but why is our hair and our skin so different as it relates to some of the medical complications that are more so related to us than others?
Got it. So I'll answer more towards the hair. Primarily because, so when we classify hair types, we usually consider them Caucasian, Asian, and African or Afrocentric. And if you were to look at, the hair shaft under a microscope, there are a number of differences. A couple of those include the size of the hair itself, the shaft, the shape of it is different. And so when you consider how, hair responds to its environment, so, humidity or, water exposure or to moisturization, when you consider things like, hair grooming practices, then it's very easy to see why Afrocentric or, kinky hair, stands out or is different from Caucasian and Asian types. And one of the things that I've come to notice throughout my practice, and also just like considering, my own experience having, kinky hair growing up, is that, our hair grooming practices really influence, the factors that contribute to hair problems later on in life. Now, and this is different. Now, there are certain types of hair conditions or scalp conditions that are universal in the sense that it doesn't really matter what your race is or where you grew up, right? Those things can happen, like autoimmune conditions. So, like people might have patches that are, related to a condition called alopecia areata. And that has nothing to do with, how you combed your hair or whether you wore a relaxer or whether you have braids or, whether you're white or you're Black or Asian. But then there are other conditions, for example, traction alopecia that we tend to see more in people with Afro type hair. And that's because, of high tension styles, right? So braids or cornrows or, wearing your hair in ponytails, the slick back with the gels and stuff. And so you won't see those necessarily or as often in other, races or ethnic groups, but you'll see them more in, patients of color or Black patients more so. CCCA is another condition that we haven't quite figured out why it happens, but, there are certain hypotheses right now. In the past, it was considered to be hot comb alopecia, where, rather than, kind of diving into who your patient is and, their experiences, there were assumptions made that it was happening because it's mostly seen in Black women. It was happening because, they use hot combs. Well, then when they realized that, well, there are patients who never use hot combs on their hair, but they were developing this type of hair loss, then, they kind of went back to the drawing board and they're like, okay, all right, well then, then it's chemical induced because a lot of women were, wearing relaxers. Well, again, with some women who don't wear relaxers develop this condition, right? And so they kind of go back to the drawing board again, and now they're like, okay, all right, well, maybe that's not the issue. It's the braids or, and again, I find that some of these approaches kind of put a lot of blame on patients, right? And it kind of takes the science out of, making a diagnosis, right? Because, if you only classify what's happening to a person based on what you assume they've done to themselves, then you really don't then approach the patient as though they're having an actual medical condition. And so your treatments, therefore, might be, well, stop wearing a relaxer or, go cut your dreadlocks off. And that's not the source of the problem. So, for example, when I see patients and I take, like a pretty detailed history from them during a consultation, one of the things that I do tell my patients is that for the most part, I offer a biopsy. And they're usually, looking, a bit skeptical, like, why would you want to do a biopsy? And, I try to explain that this is my scientific approach, right? Rather than making assumptions based on even my experience, right? I would rather that we have hard data We actually have evidence of what's happening to your scalp on a microscopic level, what's happening to the hairs that are coming out of your head on a microscopic level. And so we can formulate or figure out exactly what your diagnosis is, and then we can start to talk about how best to approach treatment.
Well, when you talk about certain behaviors or practices, are there certain things that you recommend that your patients of color do or do not do with their hair and or skin? Particularly as I start seeing a lot of people using these concealers as well in their makeup. And I know my wife, anytime she uses something on her eyelids, she always winds up breaking out. So she gets to the point where she's like, I just can't even wear certain types of makeup because I have this reaction to my skin. So are there behaviors regarding the hair and skin that you recommend or advise against people of color really using in general?
So in general, when it comes to skincare, I think less is best. And so I often advocate for using, bland cleansers and moisturizers. I know a lot of us grew up with that, the experience of if it's not squeaky clean, right? So when you use a soap, if your skin doesn't, feel hard and dry when you're done, you didn't wash it well. But we now have a lot of evidence that supports using the more bland cleansers that don't strip the skin so much of moisture, because especially, I find that Black skin tends to, dry out very quickly. And so even when, people take showers or baths, I say use products that are gentler on the skin. When you come out, you might feel a little more, slick and greasy, but that's what you need on the skin, right? You're kind of preserving some of that moisture. And then, adding on to that after taking a shower, a moisturizer. So I recommend using more thickened moisturizers or emollients like Vaseline jelly consistency or like a raw shea butter, for example, because, if the skin is moisturized, then, it becomes less inflamed, it's less dry, and it tends to be happier in that sense. And then when it comes to the hair, Black hair wants to be left alone. It does not like to be manipulated.
I try to tell Mark this, but he always gets on me when I just wake up and show up on the show.
That's really how it wants to live. That's how it lives its best life. But the more you do to it, then, the more that it breaks, it forms knots, and then of course you have a lot of complications. So I do tell my patients, like as much as you can, leave your hair alone. It doesn't mean that you definitely, you wear braids for, 3 months, but definitely the less brushing, the less combing, the happier and healthier your hair will be. And then also, if you do have to comb your hair, it's better that you do it when the hair is damp or wet than when it's dry. When it's dry, it tends to, snap and break. And some of that just has to do with the hair biology. It might not be the fact that your hair necessarily is lacking moisturization.
Thank you so much, because I guess so many things you're saying, I'm like, yes, I experience hair knots. I experience all this. I do want to go through some myths, and you tell me, if that is true or a myth. So then water cleans up your skin. You drink water and you won't have pimples or acne.
Not true.
Okay. And then also in terms of, you kind of mentioned this, but soap is best for cleaning your skin.
Soap, yes, but a more like non-soapy cleanser would be ideal. So yeah, soaps have properties that, strip the skin of moisture. So the non-soapy cleanser, which still cleans the skin, but it doesn't strip the moisture away, I think those are better. And
then like protective styles, because you kind of said, hey, Black hair needs to be left alone, but I feel like there's a trend of protective styles as if that is protecting your hair. What are your thoughts?
So not all protective. Yeah. So, the thing is that protective styles they're not all created equal. There's some that are more tension inducing than others. If you have certain conditions, where you need to wash your hair more frequently, then wearing a protective style for 3 months is, definitely going to do more harm than good. But I think overall, the idea behind the protective styles is to, be able to leave the natural hair alone. But it does need, periods where it's, it breathes where it's cleansed and where the scalp is also like, cleared up off debris, which can cause issues later on.
And then Black people or people of color, I should say, don't need, like, I guess, sunscreen or stuff like that. Myths are
Total myth. Total myth. Any skin is, susceptible to, the effects of sun damage. No, having melanin is protective, which is why, the darker complected someone is, the lower their risk of, things like skin cancer. The skin might not age as quickly, but sunscreen does offer protection regardless of your skin color. And for, brown skin or patients of color, my recommendation is typically using mineral sunscreens or physical blocking sunscreens more so than the chemical sunscreens. But those are also the ones that when you put them on, they tend to leave, a bit of a cast. So I have a lot of patients who, kind of put up resistance when I do recommend those.
Okay.
They leave a bit of a what you say?
A cast, like, that white sheen, or, sometimes it looks gray. Yeah.
Mark doesn't use sunscreen, so he's like, what?
Well, I will tell you that growing up, we never used sunscreen, and I always thought that every time in the summer when I was out in the sun, my skin just turned red. I was like, that must be the Indian in me. And the reality of it was, this is how ignorant we were. But the reality of it was, I think we were getting sunburn, and I never really equated it as a sunburn until I was probably in my late 20s. Or mid to late 20s when I went fishing and I had a muscle shirt on and got home and took a shower, and I was like, it actually hurt this time. This was the first time it ever happened. And I had marks on my shoulders for 2 years and stayed there. The outline did. So when we went fishing in Cancun, I decided I better use some sunblock. And so I went out and I bought some sunblock. And I was getting ready to apply it, and the other people on the boat, a bunch of white people, said, "What do you have there?" And I was like, "It's sunblock. It's SPF 15." And they said, "Oh, in this Cancun sun in the middle of the ocean, an SPF 15 is not going to do anything for you." Now, I was in medical school at that time, and I didn't even know what SPF stood for, and didn't know because it was just not part of my culture. It was not part of my inheritance or the people that are around me. It was not something that was usually done. So can you tell us a little bit more about the sun protective factors? And I'm told that after a certain number, it's really useless. But are there certain amounts that people of color should consider using?
Yeah, so I think even the American Academy of Dermatology recommends, like, for all patients, regardless of skin type, an SPF of 30 as like the baseline. Now, melanin actually confers about an SPF of 15 to 20. So typically when you're adding on sunscreen to a brown skin person, 15 is okay, but I generally just recommend 30 across the board. And on top of that, there are other types of, sun protection that, people can use or wear, because, sunscreens aren't without, their own issues. People that have skin sensitivities or allergies, and, they just can't wear them. But, you can wear rash guards or sun shirts, sun clothing. They have various types now. They make them in professional lines, swimwear, sunglasses too, because I think a lot of times we forget that the eyes also need to be protected from sun exposure. And then hats, right? Like, I'm sitting in the car right now, and here's my hat. Like, I know that as soon as I go outside, I need to put that on, because, sunscreen also doesn't give you universal protection. So that's another myth. People feel like, okay, I put it on in the morning and I'm good. No, after 2 hours, your protection level is back to 0 and you have to reapply. And if you're swimming, if you're sweating a lot, you have to reapply even more frequently. So maybe every 80 minutes or so. So again, I recommend using other things that can protect your skin, without the need for a reapplication. So hats, sunglasses.
And baby oil.
No, baby
oil is not good.
That's the recipe for frying your skin. That's for sure.
and SPF, because now that Mark said he know what it stands for, because you just for our viewers, SPF, what does that stand for?
Sun protection factor.
Now, and this is maybe more so personal. I have scars from my surgery. Vitamin E, does that help or is that a myth?
So vitamin E helps with moisturizing, but when it comes to scars, so scars are permanent. The vitamin E will not remove your scar. It may help the skin overall, so that the scar might look better, but it doesn't get rid of it. Now, if you're talking about hyperpigmentation, which a lot of times people confuse that with scarring, so it's kind of the result of injury as well, but you haven't really changed the nature of the skin around it. That will improve with time, typically 6 months to a year, depending on what's happening. But sometimes we have to add more than the vitamin E to help that pigmentation clear up, and so the skin looks a lot more even, like normal skin.
Okay, so to kill my spirit, there's nothing I do. Scars are just gonna be forever source of my leg. I got you.
Your scar is hyperpigmented, so there's some help there. There's some What about silicone? I know people talk also about silicone about helping prevent keloid formation, and particularly melanated skin seems to be a little bit more prone, and correct me if I'm wrong, seems to be a little bit more prone to keloid formation, correct?
That's correct. Yep. Melanated skin, Asian skin too.
Yep. So no preventative measures for that. You just have to, you're just prone to it.
Well, I mean, silicone is helpful. So depending on how recent that injury happened, or, that wound, occurred, using silicone bandages can help to apply pressure. It also helps, to kind of preserve the wound so that it doesn't, grow beyond the borders, which is what a keloid would do. But typically, if someone has, keloid prone skin, pretty much, anything you do won't prevent the keloids from happening, but you can keep them, or, improve their chances that those keloids don't get too big.
Well, it's funny you mentioned, because you guys are saying silicone. The first thing that came to mind was breast implants. And so as you kept talking, I'm like, oh, okay, there's something different. What about the myth of crossing your legs and that increases veins in the back of your legs and all that? True? No.
So it's not all false. So I think the idea is just, when you cross your legs, you decrease blood flow coming back from the legs to the heart. And so as you build up that pressure over time, if it's repeated, and, it's not a one-time, two-time thing, this is over a lifetime, then, your risk of developing, varicosities or varicose veins will definitely go up. But there's more to it than that. There's genetics at play, and there's also, whether you have a lifetime history of, walking around or standing on your legs all day, or if you have, vascular disease, or if you're a smoker. So there are other things to consider, but it's not fully a myth.
And then finally, and I'll let Mark have it, but back to the hair. So relaxers, if you have a daughter, if you have someone growing up, are you like, don't do it, let their hair just be wild? Or are you like, well, listen, there are certain relaxers that may be better than others? Or, hey, no braiding? Like what would be your recommendation as you're raising a daughter?
Okay, so for my daughter, that would be my biggest encouragement. Don't relax your hair. And it's not that relaxers are all bad either. If they're done by professionals, you maintain the hair, you have a lower risk of developing, issues with your relaxed hair, but it's an unnatural way to wear the hair. And so it will, over time cause damage to the hair. And, I think, as a personal experience, I wore relaxers kind of on and off for a few years as a teenager, and I came to a point where I was like, this thing is not healthy for me. I would get burns all the time. And I think even now, as I take care of patients and I see my own hair, I can see where even though that was a very short period of time, it's caused permanent damage to my own scalp and hair. So it's not something that I necessarily advocate, but I do understand why people would want to use a chemical relaxer. Sometimes, we don't understand how to manage, kinky hair necessarily.
Or to just enjoy it being wild. We don't understand how to just let it be, right?
Exactly.
Mark and Black men want it laid. So then
I hear Madam C.J. Walker rolling in her grave right now. Now you're going to go back and do class action lawsuits against her and her family descendants. Oh my goodness. I see where this is going.
But yes, go ahead.
Yes, no, I would just say that, we really don't know how to take care of our hair. And there's a big part of accepting what it is, right? And then we also have, that Caucasian influence in society where, if it's not slick and straight, then, it's not the right thing. And a big part of what my advocacy is to get people to accept what they have, right? And then learn how to deal with it. And who is to say that just letting your hair out as wild as it needs to be is the wrong thing? I don't think it's the wrong thing, but it also doesn't mean that if I want to wear my hair bone straight and put a relaxer in, it's also, the wrong thing. I guess we have to figure out, our right, but if that's the route that we choose, we just have to know how to take care of it so that, we're not dealing with, long-term, complications later on.
Well, that's also what I feel like as Black women when we have this trouble, because we want to be seen as pretty, but we also want to take care of our hair. And I think that's very difficult. And, I don't know, because to your point, you want to accept it, but accept it means accepting that it's pretty. And I think that's the hardest part for us to do.
It really is. I agree with that.
Go ahead, Mark. I didn't mean to.
It's not hard. It's not hard. I accept all types of Black
I was just about to say, even though you have no place in this conversation, but go ahead.
Well, the point is, I do have a place in the conversation because I think as a Black man, I think what has to happen is that Black women more often need to start listening to the Black men to say, hey, this is what we find attractive. And whether you in your own eyes find it attractive or not, that's your prerogative. But there can be, I think, this element of body dysmorphism disorder that goes on within the Black community because they have been conditioned for so many years to say that this style is not attractive and by white America. But stop listening to white America. Listen to your Black husband or your Black boyfriend or your Black relatives who are telling you, hey, I think your hair is beautiful this way, and I don't need to have it some other kind of way. And what I like most is your confidence in your self-reliance and the way that you carry yourself. And, those things all come together and are impacted sometimes by the way that you view your hair, the way that you view yourself and the beauty. So, question for you. Now, Black people often, particularly women, but even men, don't often wash their hair as often as people of other colors, of the races. And for a variety of practical reasons, some of those are also very, I think, cultural reasons more than anything. It's just how we've been acclimated in our societies and within our cultures. I was shocked to find out that there were several Mexicans who like this. I watch this every 3 weeks or so. I wash my hair every 3 weeks because it's a lot to do. Is there a recommendation for the frequency of hair washing and or application of moisturizers after it's washed? Is there a benefit to that doing more frequently? Does it become more manageable at that point or no?
Okay. So to answer your first question about the frequency, so Black hair tends to be dry, and a big part of that is the oil that we make, sebum, does not get down our hair shaft because the hair is just too coily. And so we make oils, but it kind of sits closer to the scalp. So then over time, there is that buildup versus all Asian or Caucasian hair types where they tend to have more oily hair and that hair gets heavy and slick, which is why they might wash their hair more frequently, even every day. For Afrocentric hair, my recommendation is typically to wash the hair every 2 weeks, but that varies from patient to patient. There's some patients who will tell me that their hair gets very oily, and if that's the case, they may have to wash more frequently. And then there's some who, depend on their hairstyles, they may have locks or they might be wearing braids. They can't wash it as frequently. My recommendation is typically at least once a month. But, there are some nuances to that regardless. Now, in terms of applying moisturizer, it is recommended that after the hair has been washed and conditioned, that, Afro hair is, then, moisturized, and a leave-in conditioner typically should be applied just to kind of, add more moisture back, because again, our hair dries out very, very quickly.
And white products and black products, are they the same, or?
I'm sorry?
White products and black products. So like white shampoo and conditioners, black shampoo and conditioners, is it really all the same, or are there really differences?
There are differences. There's some, there's some products, for example, like shampoos that might add more moisture, or they're, more slippage. So, that's kind of like that, slick feel, after you've washed your hair. And then, there's some that might be a little bit more drying because, depending on the hair type, you might want to pull some moisture off. So the products are definitely different. And I think for a lot of the black products, the trend is, moisture adding properties. But there is a phenomenon where you can add too much moisture to the hair, which then causes, other issues, because, black hair can be, what we call porous, so like have, holes, and it kind of sucks in moisture. But then as the hair shaft expands and then contracts, as it, loses that moisture, it causes, issues with like breakage and stuff, or where the hair like frays and you get split ends, and, it's almost like, have you ever seen wood that's been waterlogged, right? And then it kind of just like starts to, fall apart and crumble. That can happen to black hair as well.
So I'm a 53-year-old man, and my beard is not usually this black. It usually has some white peppered into there. And so recently, since I started wearing the fuller beard, I kind of like the look of a dark beard. Two questions for you. One, use of chemicals and dyes in the hair. I presume that that's probably not good. I'm sure you'll probably tell me if it is or isn't. But then the second thing was that I've seen certain products that are coming out now that says the reason why we get gray hair is because the melanocytes in the hair follicles, melanocytes, which are the pigment cells, tend to decrease in number, and that there are certain chemicals or certain medications that can help stimulate melanocyte growth within those hair shafts, and over time can have your natural black hair come back. What are your thoughts on some of those?
All right. So to answer about dyeing, so dyeing again is a chemical process that there are different types of dyes. So, it depends on how you're dyeing the hair, whether you're using, synthetic dyes, demis or semi-permanent dyes, if you're using just like natural color, or if you're bleaching the hair, right, that you have a wide spread of different techniques, and then different chemicals that are used to change the color, or to add color, or to strip the pigment. And so you could imagine that, for example, stripping might just not be a healthy one. But, it depends on who's doing the procedure, how the hair, the beard is being cared for after the chemical processing. Now, as far as, the graying, I haven't heard that much about products that actually can, induce or, cause the melanocytes to increase in number. But there's a little thing in my head that's going off and saying, that might be scary because, of issues like melanoma, right? If you have something that's like unnaturally stimulating melanocytes, I think that could be a potential problem. Now, the other thing, as far as where graying is concerned, to my knowledge, it's a part of the process is, it's kind of programmed, right, in your DNA to have those cells go through a process of what we call senescence, and they stop making pigment. And that leads to graying. But, I have seen a couple patients who have had shingles on the head. And once their shingles has resolved, patches where they had the rash that were gray starts growing black hair again. So I don't know in terms of research and what's happening on that front, if anyone is investigating that, but I think that would be something to me that'd be a little more palatable in inducing black hair regrowth after it's turned gray.
And I have a quick question. If you start balding, male or female here,
Mhm.
is there a certain age where it's just too late?
No.
Okay, so even if you're Mark's age and you're starting to bald, and even I know alopecia can be hereditary and whatnot, but I also know it seems like the myth is if you do it younger, then the follicles can open up a little bit more, but when you get older and it becomes a little too late. But from your perspective, and I take it it's injections or whatever you're gonna have to do, because I know there's shampoos that are advertised to help grow your hair, but it's not like an age once you hit 53, that's it.
Right. Yeah. There's no particular age when treating hair loss is impossible, but if someone has had an issue for a long time, so the longer you've gone without hair, it's the more difficult it is to bring the hair back. So that's more where the age comes in. So you may have a 20-year-old who started balding in his 20s, and so when he gets to his 30s, he's 30 years into the process. You might not be able to re-stimulate those follicles to start growing hair again. And again, it also depends on the type of condition that led to the hair loss too.
So we spend a lot of time talking about hair and skin. So let's talk briefly in these last couple of minutes that we have about the nails, and particularly about, and I see my wife every so often go to the nail salon and get her, what do you call it, gel or some gel coating on the nails or whatever. I'm not sure. All of the different types of treatments on the nails. Are these things helpful, harmful, or what?
So the general consensus is that over time they are harmful. So you're exposing the nails to, various chemical processes, again, where, they dry out the nail plate, and, people become a lot more prone to developing like nail fungus issues, issues where the nail plate just kind of softens over time. And so the natural nail that then grows out isn't, hard enough. And so then they end up having, a situation where they have to then start wearing, artificial nails just because their own nails have become really soft. And of course, I see a lot of patients where they've developed allergic reactions to the various chemicals, whether it's like, acrylates, which you find in, like acrylic nails, or, just even the exposure to ultraviolet light in the drying process, that also raises, people's risk of developing skin cancers on the hands. So I think overall, the general consensus is it's not a healthy practice, but so many people do it. So we just encourage giving your nails a breather, in between your applications, or getting your fill-ins or getting your gels or your dips done. And also I just remember too, like dips. So I don't know if you know that process, but it's usually a powder where the nails are dipped into it, and that's not very sanitary because everybody who comes, they're dipping into the same pot. So that's just something to kind of throw out there. If you're a germaphobe, that's probably not the thing you want to do.
I was gonna say you might not go to the nail salon in general.
But the ultraviolet light will probably kill most of that other stuff, though, right? Once it cures.
It doesn't.
No? You mean we can't shine a light in the body and get rid of COVID? Oh, I'm sorry.
Does biotin really help, or is that a myth?
Biotin by itself doesn't help. It has a small role to play in the health of your nails and hair, but not by itself. So I have a lot of patients come in and they're like, yeah, I'm taking 5,000 milligrams of biotin and or 10,000 and nothing's happening. And it's like, yeah, because it doesn't work by itself. It likes to have friends in the pot. That's how it does its work best.
And I take it the friends aren't just water.
Right.
And then there are these eyelash growth things that that people wind up putting on their tarsal plates and everything. For is that a no-no, or what are your thoughts on those?
Man, I'm gonna have a lot of upset patients now. So, I tell people everything in moderation is okay. But the truth is, and I've spoken with a lot of my, ophthalmology colleagues about this, the whole process of putting on artificial lashes, the glues, even the magnets, I think I've seen a lot of patients who have lost their eyelashes permanently as a result. They've developed, allergic reactions. They get, rashes on the eyelids that then, cause permanent damage, right? There's also issues where those lashes can, scratch, or injure the cornea, which, in some severe cases, have led to blindness in patients. So I tell people, if it's your wedding, if it's that one special occasion where you just really want to look dolled up, then yeah, okay, go ahead. But it shouldn't be a daily, part of your, your makeup routine that you're wearing it, because in the long run, you'll end up, causing more harm to your eyelids and potentially your eyes.
Well, there goes
there
our
are chemicals that actually
prospects,
stimulate growth. You're right. There are chemicals that actually stimulate growth of the eyelashes as well, that they apply also to their. Are you have the same recommendation against those, or?
So I think those products, and I think one of those is Latisse or Bimatopros.
Latisse.
Yeah.
Right, yeah. Mm-hmm.
So, and the funny thing is, like, that use was discovered in patients who were being treated for glaucoma with the same medicine, and their lashes were getting thick and long. No, I will prescribe it for patients if they ask. And there's some people who have very, very short eyelashes, or they look extremely disorganized. And, for those patients, I, recommend that they treat for a period of time. But one of the side effects or the potentials is that it can change the eye color. So for my patients who have lighter colored eyes, irises, I usually tell them, you have to be careful because that can happen, and then that change is permanent.
So if I want to get lighter color eyes, then I can probably use that then.
No, if you have lighter color eyes, I'm not sure. I may have said it the opposite way. If you have lighter color eyes, it can darken your eyes, the eye color.
Oh, gotcha. Oh, well, so much for that. Well, we could spend our entire other show here talking to you and drawing from your wisdom, but we do know that we probably have already exceeded the time, and but we are so grateful for you taking the time this afternoon and morning to come out and talk to us, and mainly to talk to Sonia about all of her woes as a Black woman with Black hair and everything else. But
thank you so much, and please come back.
How can someone who is interested in your services and or even maybe even consultation contact you?
All right. So first of all, thank you for having me on the show. I really enjoyed, sharing what I know. I always love talking about, anything related to dermatology. My office is in Cool Springs, as you mentioned earlier. So we're at 2001 Mallory Lane, Suite 207 in Franklin, Tennessee. It's 360 Dermatology. And, they can call 615-488-3376, or you can visit our website at my360derm.com.
Great. And you're having an open house for your practice sometime soon, I hear?
Yes.
Or details me?
Yes. Our open house is on June 15th. So that's 2 Thursdays from now. We start at 12:30 and we will run until 7:30 in the evening. We'll have food. So, I'm Jamaican, so we're going to have some nice Jamaican cuisine, jerk chicken, desserts. We'll have some raffles. We're also, debuting some of the devices that we're bringing on in the practice through Airlays. So we'll be able to do things like, laser hair removal, addressing a lot of the needs that patients have, kind of brought to us in the short time that we've been open. So we look forward to having everyone. And I don't quite recall our or number to RSVP, but if you check our Facebook page or Instagram page, you should be able to get that QR code and just scan and RSVP.
Fantastic. Again, thank you so much for coming on, sharing your expertise and your patience with us. It's with us.
Thank you. Thank you for having me.
Thank you.
Thank you, Mark. Finally bringing out some of your friends.
Well, you know,
I don't know if she would classify you as a friend. Finally bringing out some of your colleagues.
Now that she's gone. She classified as a friend. And colleague, thank you.
But no, this
we
has
do
been
hang out
very
socially as well.
But yeah, this has been very helpful. I definitely enjoyed it. Hopefully our viewers enjoyed it as well. Do let us know what you think. Do put in your comment section. Also, we'll probably have our guests put in the comment section where the link to the open house, as well as the link just to the website, in case you want to go directly there to sign up or schedule an appointment. But in the interim, I don't know if there's anything you wanted to say before we concluded the podcast for today. I guess you're trying to make sure the producer is on point for the ending. Okay, so what to mention before we close this thing out. But no, thank you guys so much for tuning in. We are here.
Wonderful. You're magnificent. You're awesome. What else am I supposed to say? Are you fishing for compliments again?
Well, I didn't know if you wanted to say, I did want to apologize to the Black women community for suggesting that you always keep your hair laid. Now that I have been schooled that the hair wants to be free.
Anyway, we'll talk to y'all later, y'all.
But yes, we are here every Saturday, 11 a.m. Eastern Time, 10 a.m. Central Standard Time. Also catch us on your favorite podcast platform and see some of the old episodes and give us a like as well as a comment. You've got old episodes here on Facebook, and you can also catch a repeat of this episode on Star Radio. Until next Saturday, thanks so much for tuning in.